Sunil, welcome statements there coming from the United States, especially after there'd been a lot of criticism here around the vaccine, raw material that had been required and the US not allowing that to be given. Now, of course, things have changed. The president spoke to the Prime Minister. What other details do we have?
Well, this, of course, comes in the backdrop, as you rightly pointed out, about a little bit of a souring point, a kind of a cold shoulder from the United States in terms of raw materials that were required for the vaccine and its manufacture. Now, of course, that bottleneck has been sorted out. This comes with the conversations between the two national security advisors. President Biden himself tweeting, India was there for us when we needed them. We are there for them now. I think these are very, very positive signs. This is a good sign at this stage as India, and you know that, Gargi, as we speak, every family, every close one, near one, it is now reached an epidemic kind of situation where everybody can relate to what has happened in terms of the coronavirus and the COVID disease that has affected millions of families out here. And it's in that context that the United States, apart from a host of other countries, from the UK to France to the UAE to various other countries who are supporting India in this time of crisis. And the fact that they both were able to speak to each other, apart from giving oxygen supply, the much needed, as I said, was for the manufacturing of the vaccine, the lifting of the import, which has now been resolved. And hopefully we will see some movement on that in the next few days.
The centre has put out guidelines for states on enforcing lockdowns and containment zones to try and flatten the curve amid the spiralling COVID cases. The rules say it's time for restrictions when the positivity rate is 10% or more for a week and when more than 60% of hospital beds are occupied. States have been urged to go for an intensive local and focused containment network in districts, cities and areas based on these parameters specified by the Union Home Ministry. Where or when to go for a lockdown or what the Home Ministry calls a large containment zone has to be based on evidence and analysis of the population affected, geographical spread, hospital infrastructure, manpower, and the ease of enforcing boundaries, said the Home Ministry in its note.
Please don't go out unnecessarily. Stay with your family. Very important. And also, even within the family, please wear mask. Please don't invite people into your home. This is not the time to do so. और घर में भी थोड़ा केयर रखिए कि किसी तरह से इन्फेक्शन कोई हो रखा है तो हम बाकी कोई बच पाएं, क्योंकि ये दिखाई देता है कि ये वायरस तेज गति से पकड़ते हैं ये, एंड वी प्रोटेक्ट आवरसेल्व्स एंड वी प्रोटेक्ट आवर फैमिली मेंबर्स टू द बेस्ट ऑफ आवर एबिलिटी.
The Election Commission is singularly responsible for the second wave of COVID and should probably be booked for murder, is what the Madras High Court said yesterday, in the sharpest criticism yet of crowded campaigns for 5 state polls that continued in the middle of the raging virus cases. The court has threatened to stop the counting of votes on Sunday if a blueprint is not in place for safety at the counting centres. And while the national capital recorded its highest ever daily deaths at 380 and people continue to struggle for hospital beds, a 5-star hotel has been selected as a COVID care centre for judges and judicial officers of the Delhi High Court and their family. Hundreds of rooms in central Delhi's Ashoka Hotel have been booked for this purpose, and Primus Hospital will run the COVID care services at the hotel. And there you can see new platforms being created in a park as crematoriums are running out of space. Delhi recorded 20,201 cases in the last 24 hours. Let's go across to Sukirti now for more. And Sukirti, so the number of deaths in Delhi increasing, and now, you know, we're running out of cremation spaces. These platforms are being built in parks now. Also, the news of the 5-star hotel going to be used for Delhi High Court judges and their families.
Well, yes, Gargi, and that reflects the irony of this entire situation, that in a city where a common man might struggle to find a single hospital bed at this point of time, there is going to be a 5-star hotel which will be reserved, 100 rooms at least there will be reserved for High Court judges as well as their families. The situation in the national capital continues to be very grim, with its highest daily deaths being recorded at 380. in the last 24 hours. There has been a slight dip in cases with 20,000 cases being recorded in the last 24 hours, while Delhi's highest has been around 28,000. But we have to see it in the light that our daily tests because they are anyway lower on Sundays, and especially this time they are even lower with about 57,000 tests being conducted, while Delhi's usual is somewhere near 1 lakh tests are conducted on a daily basis. So this is about half the capacity. So at this point of time, one cannot look at this data of daily cases and say that yes, we can breathe a sigh of relief because our cases have come down. So situation on ground is still very worrying at this point of time, especially the high number of deaths, which is also evident through these cremation sites which are running out of space, and new cremation platforms are being built every day, and it's a race against time right now.
All right, Sukirti, thanks so much for joining us with that. So many people still, in line for hospital beds, for oxygen that remains in short supply in the national capital. In fact, today the Supreme Court will continue its hearing on the oxygen crisis. Remember, it had taken up the matter suo motu after several high courts had taken up the issues as well. Now, the top court in the last hearing had asked the centre to put in place a national policy on issues relating to the supply of oxygen, essential drugs and method of vaccination. During the hearing on Thursday, the court had also said that it will examine the judicial power of the high courts to declare lockdown amid the COVID pandemic. This is after the Allahabad High Court had asked for 5 cities in UP to go under lockdown, but the UP government had come to the Supreme Court for relief. Well, let's now focus on Maharashtra, which is the worst affected state in the country. Now, in Maharashtra, cases have seen a welcome dip, though many are questioning whether enough testing is being done. 48,700 new COVID cases were reported, 524 deaths in the state. A case fatality rate in the state is 1.5%, while the positivity rate remains a massive 16.72%, though it has come down from initial numbers. If we speak about Mumbai, cases have dipped there as well. 3,876 fresh cases were reported and 70 deaths. The number of tests conducted there were 28,328. The positivity rate is at 13.68%, which still remains very, very high. Now, Mumbai recorded a drop in cases, as we mentioned there. However, in spite of strict restrictions, several other cities continue to have a high caseload, and the climbing death rate remains a huge worry.
While cases seem to be showing a drop in Mumbai, the rising fatality rate is a huge worry amongst doctors. From 0.53% between 5th April to 11th April, it has crept up to 1.51% in Maharashtra. Mumbai's death rate has risen from less than 1% to 1.15%. Worryingly, districts like Solapur, Nanded, Osmanabad and Yavatmal are reporting higher deaths.
ये जो पेशेंट्स की जो मोर्टेलिटी बढ़ी है, ये सब पेशेंट्स जो है वो शायद पिछले 15-20 दिनों में जो थे इन्फेक्ट हुए थे, तो मोर्टेलिटी में भी घटौती आने के लिए नंबर्स को थोड़े और हफ्ते कम रहना पड़ेगा, तभी जाके हमको मोर्टेलिटी जो है कम दिखेगी.
Mumbai reported the highest number of infections in a day, 11,163 on the 4th of April. The positivity rate was 22%. Now, after 3 weeks, the positivity rate is down to 14%. The number of daily infections is down to around 6,000 for the last 2 days. The task force set up by the Maharashtra government believes that Mumbai has already seen its peak in the second wave.
पिछले हफ्तों में जो मुंबई के आंकड़े आए हैं वो काफी प्रोत्साहनकारक हैं और धीरे धीरे कम होते हुए दिख रहे हैं. स्वाभाविक है कि हमको लगता है कि जो अप्रैल की शुरुआत में आंकड़े थे और जो पिछले हफ्ते के आंकड़े थे, उस वजह से शायद मुंबई का जो है पीक पहुंच के केसेस कम शुरू होना चालू हो गए होंगे. ट्रेंड तो फिलहाल ऐसे ही दिख रहा है.
गवर्नमेंट ने जो स्ट्रिक्ट पॉलिसीज ली है, महानगर पालिका आयुक्त ने जो पॉलिसीज बनाई है, उसका असर दिख रहा है और कुछ दिनों में काफी कम होने की आशंका है.
However, the worry is that testing has also declined. More than 50,000 tests were taking place in the city before April 16th. During this period, the positivity rate was also above 18%. Since April 17th, the testing has fallen from 45,000 daily to 40,000 daily and the positivity rate has fallen to 14%. Given the number of cases and deaths in rural districts, the Aurangabad bench of the Bombay High Court has ordered strict implementation of restrictions, saying that any person who steps out beyond the relaxation period will have to carry their Aadhaar cards, including medical and paramedic staff. In Mumbai, with Pooja Bhardwaj and Sunil Singh, Saurabh Gupta, NDTV.
Now, Karnataka announced a 2-week lockdown starting from today amid a worrying surge in COVID cases. While the public transport will not be allowed, essential services will operate between 6 a.m. and 10 a.m. Only construction, manufacturing and agricultural sectors will be allowed to function during this period. The curfew will be implemented from 9 p.m. tonight. Well, that time for us to slip into a short break. On the other side, we'll focus on Tamil Nadu. Stay with us. Welcome back. Well, let's now focus on Tamil Nadu, where 94 deaths took place in the last 24 hours, 15,684 positive cases of coronavirus have been tested in that period. And in Chennai, it was 4,250 who have tested positive for coronavirus. Let's go across to Sam Daniel for more. And Sam, tell us more about the situation in Tamil Nadu and in Chennai as well.
Well, Gargi, the numbers continue to keep rising. That's something to worry about. But certainly authorities say they have ramped up the infrastructure, and in that sense they say things are under control. One good thing they see even amid this rising trend is that compared to the numbers on Sunday, yesterday there was only a rise of 0.1% up. So in that sense they hope this kind of flattening at least will start from now amid the second wave, and they'll be able to bring it under control. Tamil Nadu's overall tally has crossed 10 lakhs and over 1 lakh active cases or in hospitals and home isolation at the moment. And yesterday, to tackle the shortage of remdesivir, the antiviral drug, particularly in private hospitals, Gargi, the state government has offered it at a price of 1,560 for those patients whose family could produce a doctor's certificate along with a CT scan report and a positive certificate to make sure the shortage is beaten. And Tamil Nadu also has opened the reopening of the oxygen plant at the Sterlite factory in Tuticorin for 4 months to ensure there will be supply of medical oxygen on a priority for Tamil Nadu and for other states as well. And Vedanta says it's committed to supply 1,000 tons. Chief Minister EPS has urged Prime Minister Modi to procure the required vaccines for states and supply to them because he feels the differential price mechanism for central government and state governments is very unfair. And Puducherry has further tightened. It has decided to shut all the liquor shops, including shops selling Iraq and toddy, till 30th of this month. While several states across the country face shortage of beds, ICUs, ventilators, even oxygen supply, Tamil Nadu, which already has a robust healthcare system, has even tweaked it over the last 1 year ever since the pandemic struck to ensure every positive patient would get quality healthcare.
At COVID screening centers like these in Tamil Nadu, health workers prioritize patients after a series of tests, including an X-ray, CT scan, blood count and oxygen saturation. Asymptomatic patients are advised home isolation. Those with mild symptoms are shifted to a 5-day stay at Corona Care Centers or Corona Health Centers. Only about 10% patients with severe symptoms are admitted in hospitals with oxygen, ICU and ventilators. This way the state ensures only those who need critical health care get it at government hospitals. Arun, a budding assistant film director, has been advised to rest at a Corona Care Center.
I can't be in quarantine in my home. There is no separate bathroom, right? So
is this better in that sense?
Yes, this better because my family will be safe.
Jawahar's daughter, who tested positive after a family tour, would be on home isolation.
The service is very good. In fact, I didn't expect they were so quick and prompt. It was really fast, well coordinated.
Tamil Nadu has over the years prioritized public health infrastructure. As against 0.55 beds per thousand population in the country, Bihar has 0.11 beds per thousand population. Tamil Nadu has 1.1 beds per thousand.
If we follow this discipline, then there is no question of shortage of beds at all. All those things we have factored in. I'm not talking about just the 4,000 cases. I'm even anticipating an increase up to 6,000 or even 7,000 in another 20-25 days, because that is where...
Is that the projection?
Yeah, that is what the projections are also.
Public health care has always been on the agenda of political parties in Tamil Nadu, and the state has focused on building its infrastructure and a cadre of healthcare professionals spread out across the state, working on weak areas post the first COVID wave. In Chennai with Suresh, Sam Daniel, for NDTV.
Well, let's focus now on the national capital. And while Delhi recorded its highest ever daily deaths at 380 and people continue to struggle for hospital beds, now a 5-star hotel has been selected as a COVID care center for judges and judicial officers of the Delhi High Court and their family. Hundreds of rooms in central Delhi's Ashoka Hotel have been booked for this purpose, and a private hospital will take care of the facility. Let's go across now to Sukirti for more. In Sukirti, firstly, the worrying situation in Delhi. It's a fight for, hospital beds, for oxygen, for medicines as well, and even for cremation space now in Delhi, and more space is being created. But at the same time, you get this news that a 5-star hotel, a COVID care facility is being put up for judges there.
Well, yes, absolutely, Gargi. This is the irony of the system that we have in the national capital at this point of time. I'm standing outside the Ashoka Hotel in Chanakyapuri. At least 100 rooms here have been reserved for Delhi High Court judges, judicial officers and their families. This was a judgment passed by the Delhi High Court. The Delhi government had to follow it, and as a result, the Primus Hospital in Chanakyapuri will be running all the COVID services here. So that is what the Delhi High Court judges are getting, but what is the common man getting? As of this moment, if you go to the Delhi government's Corona app, and we will be playing that screenshot on our screens as well, on how currently in the national capital there is just one ICU bed with a ventilator, one ICU bed with a ventilator in the national capital of India for the common man. Even ICU beds without ventilators, there are just 11 of them. So 11 ICU beds without ventilators, one ICU bed with a ventilator, 12 ICU beds in total in New Delhi. But for our Delhi High Court judges, there are 100 rooms in a 5-star hotel being set up at this moment. The Primus Hospital helping in that entire situation. But for any common man in Delhi, it is a struggle to get medicines. It is a struggle to get a hospital bed. There are people running from pillar to post, remdesivir, tocilizumab, Fabiflu. We can go on with that list. But an individual cannot get it at a regular price. They cannot get it easily. They will have to run to 30 different places. We've met people who've bought a remdesivir that costs 5,400 for a price of 35,000 or for a price of 57,000 from the black market. For hospital beds, they've run around government hospitals, they've run around private hospitals. They are unable to get beds. As of this moment, 12 ICU beds in total, just one ICU bed with a ventilator in the national capital. But those in power, they can get 100 rooms in a 5-star hotel. That is how bad and how ironic this entire situation is. We have recorded 380 deaths in the last 24 hours, the highest ever for the city. 20,000 cases, slight dip in the cases, but not sure how much we can rely on these figures as a trend, because there was the Sunday dip in testing. We tested only half of what we test on a usual basis. So for figures will have to be consistent for a few more days before we can say then Delhiites can breathe a sigh of relief. But at this moment, the common man in Delhi likely to continue his struggle.
All right, Sukirti, thanks so much for joining us with those details. So the struggle there in Delhi and a COVID facility in a five-star hotel for judges. That's the irony of the situation. Now, so we have a crisis in Delhi, also in Bengal, a crisis being reported there, and in Karnataka as well. One of every two people undergoing an RT-PCR test in Kolkata is testing positive for COVID. That was the news last week. And while in Karnataka, it is going in for a lockdown from tonight after reporting the highest numbers ever on Sunday evening. Well, to talk more about the situation, we're joined now by Dr. Sankaran Sundaran, Head International Transplant Services, Manipal Hospital, Dr. Saswati Sinha, Senior Consultant, Critical Care, Amri Hospitals in Kolkata, and Dr. Suranjit Chatterjee, Senior Consultant, Internal Medicines, Indraprastha Apollo Hospitals. Thank you so much, doctors, for joining us on the show this morning, on the channel this morning. Dr. Sinha, first to you, if you could tell us about the situation in Kolkata. Bengal recently reported the highest numbers ever. Bengal recently reported the highest numbers ever, and every second person who is testing for COVID in Kolkata is testing positive. All right, it seems we haven't been able to connect with Dr. Sinha yet, so I'm going to go across to Dr. Sundaran. Now, if you could tell us about the situation in Karnataka, because now the state is going under a lockdown. It's being called a curfew, but essentially it's a lockdown from tonight. And there were also reports of, how in Bengaluru as well, they were running short of hospital beds, that it was a fight for to people to get their loved ones into hospitals. What's the situation like right now?
The situation is quite nightmarish. In fact, I am quite scared whenever I get phones from my friends from all over India. The first question I ask them, please don't ask me beds, and I'm not able to help. Even a week ago, one of my own colleagues' father, I couldn't help. He had a transplant in Calcutta and was on follow-up with me. And she is a doctor herself, and we couldn't get bed in any of the major hospital, and we lost. And I have quite a few transplant patients out in different hospitals trying to get into a major hospital for care. It's quite scary. I never felt like this in the last 40 years as a nephrologist. I deal with death every other day because I'm in a high-risk field, but never ever felt so low, so helpless, and it is quite nightmarish. I don't know what to do. In fact, I'm looking at the figures, how to get beds every other day, every hour. In fact, every minute we get calls asking how to get into some place. Oxygen is dropping. Where do we go? Whom do we contact? There is no system. I mean, it's easy for us to blame anybody. I don't want to blame anybody. I'm really, I'm lost for words. To say cliche is different. I know the virus is different and it has come like a tsunami and nobody can be blamed as such. But what do we do? How do we go about it from now? That is the question. But I think this lockdown is important. A lot of people are saying lockdown is not important. Look at all over the world. My son is a doctor in UK, another son in Singapore. All of them tell me lockdown is part of treatment. Let's understand that. Let's not play politics on that. Lockdown is important. And all other COVID behavior, all those things are important. And oxygen, all that is important. But lockdown, I think at this juncture, when the health services are overwhelmed, I am actually waiting for the lockdown. I'm happy the government of Karnataka, they don't want to use lockdown. I know it's politically incorrect, but whatever it is, we need some sort of lockdown to take care at this juncture. Otherwise, it's going to be chaos.
Absolutely, Dr. Sundaran, though, lockdown, as we know from all the experts, is really the last option. But we've reached that stage where we're at the last option that we need a lockdown. We need, some sort of relief for all of you doctors and hospitals that are just struggling right now with this situation. We have Dr. Sinha with us as well. Dr. Sinha, I started by, in fact, asking you. I wanted to focus on Bengal situation, which is very, very worrying. It reported the highest number of cases on Saturday in the month. And also we're hearing reports of how every second person who is testing for COVID, who's taking the RT-PCR, is testing positive. And that really also begs the question, there are enough tests being conducted. You know enough about the spread of COVID in the state that is even now, just saw another phase of elections yesterday.
It's a completely mind-boggling scenario here in Kolkata. And the exponential rise in the number of cases in the last 2 to 3 weeks has completely overwhelmed the system. And me being a critical care physician, we are completely at a loss as to how to accommodate more patients. The hospitals are being asked to ramp up the number of beds to care for COVID patients. But ultimately, the manpower and the infrastructure remains the same. even if we increase the number of beds, who's going to take care of this ever-increasing number of patients? And we keep getting calls from all over, from people we know, that they're all frantically looking for beds.
And what is the oxygen situation like?
Fortunately, till now, we've not faced a problem with oxygen. But what we're hearing is if the cases surge further, I really do not know if at all we will be faced with an oxygen problem, which will be an absolute disaster in the middle of a COVID pandemic.
That's right. And here in Delhi, we're already struggling with that. Dr. Chatterjee, is there some relief now? Because it's been over a week that, this oxygen crisis in Delhi is continuing. And as many doctors and, those who are managing hospitals have pointed out that, they're trained to care for patients. They're not trained in this sort of oxygen politics or running to the High Court to ensure that they're given this oxygen supply.
Absolutely true. We are ready to work hard for all our patients. Everybody is really working 24 hours almost to save these patients. But when we find that this patient needs so much of oxygen and we have to really rationalize them, or we have to curtail the amount of oxygen given to the patient, it is really, really distressing. We can see patients in distress in front of us, not getting enough oxygen. That was a situation a couple of days back. It has gradually improved. Actually, what we had to do quite a few times is just to cut down on the number of admissions because of lack of oxygen. We had beds available with us, but we had to curtail admissions because of lack of oxygen. This is disaster in a pandemic situation. Whenever we are ready to work, we are there, but the basic infrastructure had to be available to even save these patients who are suffering from this disease.
Right, absolutely. And now we're hearing that, the Oxygen Express is coming into Delhi, and perhaps the situation will ease in the next couple of days. But yes, it's really, a monstrous situation for all of you doctors who are dealing with this right now. Thank you so much for sparing your time and joining us on the channel this morning. With that, time for us to slip into a short break. We'll get you more news on the other side. Stay with us. Welcome back. Now, as the coronavirus pandemic sweeps through the globe, India is seeing an unprecedented rise in the number of daily deaths. But the number of bodies streaming into the cremation grounds far outnumber the COVID government figures. So is the government undercounting the number of dead? NDTV does a reality check.
The impact of the deadly virus wave. The skies above Delhi dark with the smoke of hundreds of the dead being cremated. In this cremation ground in Sarai Kale Khan in South Delhi, the COVID dead are piling up. They can only cremate 20 a day, but every day brings 60 or 70 dead. So many that they've had to build close to 100 new cremation platforms in a park nearby.
मुर्दा को जलाने के लिए देख लो आप बना रहा हूँ आज 3 बजे तक मैं तैयार कर दूंगा इनको ठीक है सर।
यहाँ पे अभी कितने कोविड पेशेंट्स की बॉडी जलाने के लिए जगह और अभी कितना और बना रहे हैं आप?
अभी यहाँ 20 बना रहे 100 उधर पीछे बना रहे ठीक है। पेशेंट का जगह नहीं है इसी वजह से जल्दी बना रहा हूँ लोग ऊपर से मेरा प्रेशर है इसी वजह से मैं जल्दी करवा रहा हूँ ठीक है सर।
कितने कोविड पेशेंट्स की बॉडी के लिए अभी जगह है पर बॉडी आती कितनी आपके पास?
कम से कम 70-80 तो आ ही जाता सर जी।
पर जगह कितनों के लिए अभी?
जगह कहाँ है जगह तो नहीं है इसीलिए तो मैं 20 इधर आज रात से चालू हो जाएगा ये।
These huge crowds at cremation sites don't seem to match the official figures, which raises the question, are there victims of COVID that are not being counted? Official records accessed by NDTV find that in the past 7 days, over 1,000 COVID deaths in Delhi may have gone uncounted. Data collected from the Municipal Corporation for 26 municipal-run crematoria finds that 3,096 cremations of COVID victims were conducted in the past 7 days. But the total figure of COVID deaths released by the Delhi government in the same period only show 1,938 deaths, a difference of 1,158 deaths. Clues to the mismatch here at the overflowing Ghazipur crematorium on the outskirts of Delhi, where families of the victims of COVID wait for their turn to complete the paperwork.
क्या वो घर में डेथ हुई है?
हाँ, घर में डेथ हुई है।
किसकी हुई है?
नगर की, हमारी मालवी में भी।
According to the official here, those who died at home are not recorded as COVID cremations.
जो लोग घर से आ रहे हैं, उनका कोविड रिपोर्ट करते हैं या नॉर्मली करते हैं? नॉर्मली करते हैं। अभी तो हॉस्पिटल से आता है वो तो सीधा अपना एम्बुलेंस में भेजते हैं, ये लोग अपना घर से तैयार करके लाते हैं। और लेकिन उसकी भी अगर रिपोर्ट देखी जाए वो ब्रॉड डेथ होता है, पता चलता है तो वो रेस्पिरेटरी फेलियर का ही आता है ज़्यादातर। हॉस्पिटल लिखा जाता है और किसी का घर पे होता है तो घर पे लिखा जाता है, किसी का रास्ते में होता है तो रास्ते में लिखा जाता है। ये लिखा हुआ कोविड पॉजिटिव। बीमारी क्या है, मृत्यु का कारण कोविड, नॉर्मल कोविड पॉजिटिव। लेकिन जो घर पे वो नॉर्मल कोविड लिखते ही नहीं है। हाँ जी, क्योंकि पता ही नहीं है।
Manish and Neil Gupta have spent 4 hours waiting to cremate their father who died of COVID. Manish says he died at home.
मेरे फादर हैं, ऑक्सीजन की वजह से उनकी डेथ हो गई। ये यहाँ पे मंडावली अस्पताल में नहीं, घर पे रहे थे। हॉस्पिटलों में गए, प्राइवेटों में गए, हर जगह गए, कहीं ऑक्सीजन नहीं मिला। पैसे भी देते रहे तब भी कहीं सीट देने के लिए तैयार, बेड है तब भी नहीं दे रहे, कहने में सीट ही नहीं हमारे पास।
तो आप यहाँ कब से आए?
सुबह से आए हुए।
कितने बजे?
सुबह हम आ गए थे 8:30 बजे। सुबह 4 बजे आए, देखा, फिर उसके बाद फिर 6 बजे आए, फिर फिर रात को अभी शाम को भी 9 साढ़े 9 बजे लेके आए।
अच्छा, अब आपको क्या लगता है कितने बजे होगा?
ये अभी 3:30 बजे का टाइम दे रहे हैं।
3:30
एक साथ पूरा दिन लग गया। वैसे इतनी परेशान है ऑक्सीजन के लिए, अब जलाने के लिए परेशान। सरकार तो बेकार है।
The surge of death is so high that NGOs are stepping in, like Jitendra Singh Shanti, former BJP MLA and a social worker, seen here sanitizing the COVID dead before they are cremated. Shanti's NGO, which helps run this makeshift crematorium in Simapuri in northeast Delhi, confirms official figures don't reflect home deaths.
हम अभी एक और शमशान घाट गए, वहाँ पर they were saying कि जो लोग जिनकी डेथ घर पर होती है, उनके पास कोविड रिपोर्ट नहीं है, हॉस्पिटल से नहीं आया, वो नॉर्मल की तरह रिपोर्ट होती है। यहाँ पर भी ऐसा कुछ हो रहा है?
ऐसा ही पूरी दिल्ली में हो रहा है। 40 से 50 डेड बॉडीज डेली हम घर से जो क्वारंटाइन में लोग मर रहे हैं उनको उठा के रेस्क्यू करके ला रहे हैं। जो सरकारी आंकड़े हैं प्रशासनिक, वो उसको मानते हैं कोविड का, जो वहाँ से मर के थ्रू मोर्चरी आए, ठीक है, जबकि जो घरों में मर रहे हैं उसको ये मानते ही नहीं। बहुत बड़ी बात है, तो आंकड़े गलत हो गए ना।
Outside the Sarai Kale Khan crematorium, the wait to cremate is so long, this family member in a PPE has collapsed in exhaustion and heat. Whether the death of his loved one will make it to the official record remains to be seen. With Sukirti Dwivedi, Ashok Mahale and Pooja Arya, Meher Pandey for NDTV.